Joining me now are the three legislators who are proposing this reform of the state's Medicaid system. They are Democratic Assemblywoman Amy Paulin, Republican Senator Patrick Gallivan, and Republican Senator Roy McDonald. Senator, Assemblywoman, thank you very much for being here. I appreciate it. So I'd just like to start with you, Senator McDonald, if you would just sort of generally speaking explain how you came to this particular position.
The conception was relatively easy. The property tax burden for the average person in upstate New York has reached the point of saturation. They can't pay it anymore.
Right.
And they looked to a tax cap coupled with mandate relief to help them out. Well, we're providing that mandate relief. And Medicaid is the biggest single item impacting county governments in New York State. We're the only 2 out of 50 states. There's 48 states that do not require local governments to pay. We're one of the 2 states, New York and California, that do require that. And that's placed a very large tax burden on the property taxpayer of upstate New York. Upstate New York is struggling in many different geographic regions, and it's my hopes that this goes a long way of taking some of that property tax burden off of them.
So effectively, this is what the Mandate Relief Task Force was supposed to do, not this necessarily per se, but to come up with some kind of significant relief to go hand in hand when you all voted yes on the property tax cap, right?
That's correct.
That you believed that that would come, and so you're basically helping it along. Is that right?
Yeah, a good way to put it.
Okay.
Everybody, I think every rational person knows that a property tax cap works only with significant mandate relief.
Right.
And of course, in listening to the 80+% of people across the state screaming for property tax relief, we did that with a property tax cap. Now we have to make it work. The mandate relief team was there. Nothing of great significance came out of it.
Well, they're still working, which is to be fair.
And we did pass a little piece of mandate relief legislation in the property tax cap legislation. But the single biggest driver of property taxes at the local level is the mandate of Medicaid.
Right.
And this provides that relief.
Assemblywoman?
Well, just to set the record straight, I didn't vote for
you
the property.
Okay. You were giving me the look, and I was like,
yeah. Well, I don't want to give up false
impression. She was a no. Sorry.
And a good part of that. When I made my speech on the floor, I do support capping property taxes, which is why I'm a big enthusiastic supporter and sponsor of this measure. We need to make sure, Westchester has the distinction of having the highest property taxes, not just in New York State, but in the nation.
Yep.
So it's forcing people out of their homes. Seniors are unable to stay in the county after they've spent their whole lives devoting themselves to the county. Young families can't move in. People who have lost their jobs can't stay there. So we are in a terrible position. 40% of Westchester's county taxes are Medicaid. $211 million this year. 40%, that's a lot of money. Without this relief, it will mean that they're going to go up 3%. Medicaid is going to go up 3%. And they're capped at 2%. So what are we going to cut? Parks?
Well, right. That's a problem, obviously. Here's the other problem. Not just 40% of the local budget for Westchester, but 40% of the state budget goes to Medicaid. So what you're suggesting is an increase in the state share, that the state take over the local share. So where's that money going to come from?
Well, the state's spending what we did in this last year's budget through legislation. The state share is now kept.
Right.
It can grow only up to a certain amount per year as we move forward.
Right.
But a number of things that are going to happen over time. First, this piece of legislation, it starts by freezing the local share.
Yep.
And then shortly after that, we begin an 8-year phased-in state takeover.
Right, so it's not just one day the bottom drops out.
We don't take $7 billion and all of a sudden have to be responsible for it.
Yep.
But a number of things are already in play that will be taking place over time that we should be realizing savings that we can use. We've got the Medicaid redesign team is in place. They will continue to work.
Right.
We've got the Affordable Care Act, the federal health care legislation, that certain provisions will ultimately produce savings over time. We know through prior legislation that the state has to take over the administration of the program statewide by 2016,
Yep.
and that should realize some efficiency. So all of these things come together and we slowly phase this in so that it's manageable.
Okay, but here's another problem, and I know, and Senator, you and I have had conversations about the drastic need for services, particularly among vulnerable populations. The danger, of course, is that if some of these healthcare cuts can't get made, the state will actually do it itself, the State Department of Health, right? So is there a danger here?
I don't think
that
there's a
services
danger.
will be
I think
cut?
a lot of the things that Patrick was talking about are going to come into play. But we had to bring this forward. A month from now, 6 weeks from now, you're going to be doing stories about upstate counties presenting their budget. They're in a calendar year, and you're going to see the threat of lost jobs in health care there, in nursing homes, mental health facilities that the counties are involved with, as well as sheriff's road patrols and so many other issues. We have to have an opportunity to talk about this mandate. It's the biggest, it's the most significant to the county governments and to the property taxpayers and the portion of their property taxes they pay the county. We started it now. We started the legislative session for 2012 today in 2011. And there's a reason for that. We want the input of all the appropriate people, the governor's office, different commissioners, the local officials. We want that, but something's got to be done here. And as Amy said, we have a situation where the mandates have got to, be in conjunction, mandate relief with the property tax cap, or we're just going to be hurting people all over the place.
Right, and we're already seeing communities start to put together their budgets and talk about overriding that 2% cap, particularly those that were hit with storm recovery requirements, which is, and to just piggyback on that, I'm seeing other local elected officials, Ulster County Executive Mike Hine, for example, say, well, we want the state to pick up the share, the 12.5% share of that too. So we're talking about locals that are hurting it, and I think everybody understands that.
And remember, the locals are also the ones providing many of the services for the vulnerable.
Right.
So when we talk about cutting monies to the vulnerable, probation is only funded 12 to 13%, services to people who we're trying to make sure that they don't commit another DWI. We're trying to shore up the PINS program. So what we're doing, the locals are paying most of it anyway. So what they're going to do is they're going to cut that. So we're going to see domestic violence services, child care services, all those things that they don't have to do. They're going to be gone.
But do you, and I know particularly in your House, the Democratic majority is very sensitive to issues like all of the services that you just spoke of, particularly in urban centers where the need is highest, generally speaking. Do you think, first of all, do you all three believe that this can be achieved without service reductions to Medicaid recipients, and do you think it's palatable for your respective conferences? I could see where the Senate Republicans would probably be on board, but would the Assembly Democrats be on board?
Well, I have a lot of support already from key Democrats in the Assembly, and I'm hoping that there's going to be a huge push from the City of New York, a huge push from the counties of Westchester, Nassau, Suffolk, all of those areas where we have a lot of Democrats in the Assembly because they know they can sustain their services and sustain this program at the same time. I agree with you. Cutting the program and the what the recipients get, is not something that I would even personally support.
Right.
But we have to cut the local share.
Because and then to just turn that around for the Republicans in the room, and it happens to be 2 against 1, so forgive me. But seriously, Rob Astorino, for example, has been here having a conversation with me, and he's pretty conservative on this particular area. He's actually your county executive, Assemblywoman, Westchester County, and he said, I could see Medicaid cut services, dentures. No dentures. Maybe eyeglasses, maybe hearing, maybe some of these things that are not necessary, that you only need to cover absolute need in terms of health care. Is that something that you could agree with?
Well, in what we're looking to do with this legislation is essentially align the fiscal responsibility with the decision making. I feel pretty confident that the things that we talked about earlier, some of the changes that will be taking place as we go forward, along with the efficiencies realized and enhanced cutting out of fraud and waste, can ultimately pay for all of this so that we can make sure that the people who need the services get them. Some of the, under the federal health care legislation, they will pick up the cost of some of the services that we're already paying for, in whole or in part. So I am confident the way that we're doing this, phasing in over 8 years, that the realized savings and efficiencies can pay for the necessary services.
And Senator McDonald, you brought up this idea that you wanted to get this out early so you could get everybody around the table, which is actually sort of a Cuomo-esque approach, right? Because I don't want to put anything on you, but because he brought all of these disparate interests to the table early during the budget process and then had people agree to something that they normally wouldn't have. Have you spoken at all to anyone in the administration about this?
Well, the New York State Association of Counties has been in touch with the second floor. In addition to that, Patrick and myself, and I'm sure Amy as well, have seen the governor. I think he's been very reasonable and very responsible in these financial areas, and talked about the possibility of maybe, depending upon a variety of circumstances, and a plan to take over Medicaid. Now, Patrick, Amy, and I are nonpartisan in this proposal.
Yep.
Amy and I have proposed other legislations together, and I hope we'll do more in the future. But what's really significant here is, I have an urban area in my district, a large one, the city of Troy, which I happen to be originally from, going to do nothing at all to hurt the city of Troy or the people in that city. We're going to be there, but we have to protect the revenue stream. We want to help the people who desperately need our help and legitimately need our help, and at the same time, we don't want to waste money on areas that are inefficient. And we cannot bankrupt the county government. And most of the counties we're talking about, it's upstate counties. I represent upstate areas. Can't allow them to be bankrupt into oblivion, which will cause even greater chaos. So it's not an easy task. We're doing it early because we want to enlist the help of everybody. We're not being critical of anybody. We're enlisting friends and allies because I think this is a legitimate thing. Amy pointed out that it's very legitimate for the folks and the legislators in New York City, and you might want to discuss that, how economically it's significant for them to be a part of this as well.
The expected savings from the first year for the counties and the city combined is $258 million. Half of that savings is for the city of New York.
Well, the largest
They
area
have half the recipients.
Yeah, this other, we should also know, and unfortunately we're about to run out of time, it is obviously something that we'll be discussing again and again. And again,
We certainly hope so.
Right,
we
no,
hope
we
this
will.
begins a discussion.
But it's also two things of note. A, we have sitting with us here majority members of both houses. That's a very significant thing because really, let's be honest, you can't move legislation without that. Majority sponsors on both sides, so that's a good thing. The other thing is it comes at a time in the national stage when we are having discussions about entitlement programs vis-a-vis politics, vis-a-vis should we cut them or should we not cut them. So I'm sure that the politics of this, it is also going to come into play. It's an election year. Are you concerned about that? Anybody? We got one person to answer this particular question. Go for it, Senator.
I'm thinking about it right now.
No, I was, I'm the most recently elected.
You are.
And I was sent to Albany to do something, I believe, about the out-of-control costs, about property taxes, getting a handle on state government spending, realizing efficiencies where we can, cutting fraud and waste. And I think this aligns perfectly with that.
I agree. I'm concerned about the 19.5 million people who live in New York State. They don't want to hear politics anymore. They want action. I think in the last 6 months you saw that earlier this year. We did our job. We started our job early today. We started the session today, and we're going to do our job again.
Okay, well, there you have it. We are going to be, last word to you, Senator McDonald. I want to thank you very much. Assemblywoman Paulin, thank you. And Senator Gallivan, thank you very much for being here. And we will be talking about it again, so I'm sure you can all come back if you want.
Thank you.